was unable friend Vernon, and you can see our pics on Facebook. Attempt the okay. What is this? Attempt the quiz now. It's going to ask me for the code. Input the code by the AMS Secretariat Training Hub. This is the code given to us. This might not be the code that will be given to you. Okay, finish attempt. Those who were able to see the pre-test, this is the repeat of the post-test. So submit all and finish. Yes. Do we get our... Yep. We got it. And it's going to let us go to the next activity. This is like a password. It's not going to be the same for you. This is generated by the computer. The Antimicrobial Stewardship program is very easy for the medically inclined. So we're going to attempt the quiz now. The grade to pass is 16 out. We have a backup. Continue. Ha! We have a backup set. So we are still streaming. Just so we can see if I really am still. Okay, let's check our stream if we're still streaming on YouTube. So if you're joining us, this is already the 3rd episode. Yeah, there we go. Fortunately, here in Vegan, Globe data, mobile data is showing to be really cool. So let's go. Let's go check our... Okay, let's go. So, question 1 for the post-test. Aside from the National Antibiotic Guidelines and the Philippine formula, so it will be based on all of these things except for so local and national antimicrobial resistance and usage. Correct, because they are like a mandate. National AMS ordinance for PHC settings to be formulated. It's an ordinance to be formulated so infectious diseases. These are the clinical practice guidelines and usually are apt for the local health settings. Current DOH standards, yes, for rational antibiotic use. So again, a mandate. Only the evidence-based guidelines is optional. Certain provisions on the CPG can be modified because it's a guideline. Guidelines are not mandates. It's a way for physicians, nurses, and pharmacists to follow. So that's the difference. Okay, it doesn't necessarily mean that a certain physician has to go to Ceftriax whenever he thinks administer coamoxiclav. So that's an example. So if he can administer a lower class drug, depending on how he or she knows the patient, he can government practice may be different from that of the CPG or on the mandates. So it's dangerous to create local mandate, but it's because of the mandates may preclude the use of expensive medications that may not be needed or those with high adverse effects. So that's our reasoning on the first of this series of videos. So I think I got that one correct. So AMS committees in the municipal and city levels should submit to the DOH. Again, in the last episode, the main word here is weekly. It's not weekly, it's quarterly. Okay, so we had to check that. The guidelines in AMS says at least quarterly. But since you are going, this is the DOH Pharmaceutical Division, they report quarterly to the DOH central office. So the following statements are true when creating an antibiotic policy. All hospitals shall have a hospital antibiotic policy. Every SOP, whether it's public or private. The policy shall be reviewed in test taking strategies. This is already all of the above. But as you can see in here, letter F is A and C only. But since B is correct, this is all of the above. We don't even need to read C and D. You know, primary aim is to minimize the morbidity and mortality due to antimicrobial. We'll find out later. Antimicrobial resistance is a complex public health concern that requires united and coordinated multi-sectoral action. The following sectors are affected by the AMR. Of course, energy sector is not. So select one or more, it's probably all, but the energy sector. What are the goals of the A? Reduce antimicrobial, reduce healthcare loss, and improve patient outcomes. So this is a reaction video. The DOH may change the questions later on as they develop more and more batches of this antimicrobial stewardship training. So let them do the hard work themselves. Antimicrobial resistance is a global public health concern that should be treated with urgency. Of course, that's true. Otherwise, medical advice will be judged. Of course, it is true. Because we do not want, if we can prescribe lower class antibiotics, it will be and maintain the effectivity of the lower class antibiotics. We do not need to find other antibiotics because that would entail a less cost-effective way. So it will lead to more poverty, especially to our country, the Philippines. So select all possible areas of monitoring for the AMS program. All of these, I believe, they have this. So look at this. For some reason, the DOH placed 2 barangay health stations, you know. Boom, independent private clinics, boom, health centers. So I remember that the local public health hospital was wrong. I don't know why that's wrong, but it should be probably because they have a different monitoring program. So I have no idea why local public health hospital is not included in this question. It's supposed to be wrong. I don't know why. Maybe they will change it on the next set, because I remember this on the So I do believe that we need to be monitoring also the local public health hospital. Like in our setting, we have the James L. Gordon Memorial Hospital in Olongapo City, which has to be monitored with antimicrobial stewardship. So select what are 6 core elements. So we have 7. I think I knew the answer. Yeah, on the first surveillance, yes, that's part of it. It's going to be global awareness and sustainability, because that will be like the WHO. So antibiotic guidelines, clinical pathways. Let's go with it. Misuse or overuse of antimicrobials in humans and animals is one of the biggest drivers of antimicrobial resistance, or AMR. That's true. What compliance? Oh wait. Self-diagnosis and self-medication also, yes. Use of antibiotics, so this is all of the above. Because use of antibiotics, animal growth promoters, is one of the problems. That's why we include the Bureau of Animal can be bought in stores that provide feeds for the chicken and pig growers. Yeah, I was able to check that one. So they actually sell amoxicillin 500 milligrams per capsule for without prescription with a veterinarian. I was able to buy one just so I could check the quality. It doesn't look different from the amoxicillin generic, so it's one of the problems. It's not, I think it's not regulated, but it should be regulated by the Department of Agriculture. So I think it's all A, B, and C. Number 10, antibiotics can be used to prevent or treat viral infections. So again, biotics. Biotic, it means living organisms. Antibiotics is medications against living organisms. So this is something. This is some sort of question mark here with regards to how they use the word. Antiviruses are not living things, so that's why they're antiviral. So I don't know. Maybe it's just me. So let's just go with as antibiotics. But is it used for asymptomatic or mild COVID-19? No. Why? Because it's a viral infection. Why would you give azithromycin even though it showed on asymptomatic patients? Because if you provide a big dose of azithromycin on asymptomatic patients, like azithromycin, which was once part of the regimen for COVID-19, you might invite antimicrobial resistance, because the gut contains not only good bacteria but also bad bacteria in low amounts. So if you are not judicious with giving antibiotics, you might induce growth of bad bacteria. So let's go. Just keep going. Next page. This is number 10, so I guess we got half of the questions. Hello there. Okay. The following are involved in the implementation of the AMS program in the primary healthcare settings. All of the above. I do believe so. Let's check. Yeah. Implementation, Select which should be the basic basis and guides in adoption, and implementation of antibiotic policies. Guidelines and the Philippine National Formulary. Batiri ka ng Bayan is like an NGO, I believe. PNF, full manual for hospitals. For some reason, they're excluding hospitals in this AMS. Guidelines for medicine donations management is part of the DRMH. No, I think this is too. Antimicrobial stewardship. No resistance. Bacteria, viruses, fungi, and parasites changes over time. No longer respond to medicine. This is resistance. A sustained One Health approach. I made the mistake in the pretest, so that's why I know about this. In order to ensure efficient government response, we need the DOH, DA, DOST, DTI, and DILG. Yes, not the DOE, the Department of Energy. Again. Let's go. Remember number 11? I think it's local therapeutic. We're going to go back with 11. Just check this one. Is the concerted implementation of systematic, multidisciplinary. It's antibiotic. The whole lesson is all about antimicrobial stewardship. Antimicrobials or antimicrobial are referred to, not antibiotics only, all above except A. So yeah, antibiotics. Yeah, go. I don't have to explain, I already said it. Who is responsible for filling up prescription for antimicrobial agents? The pharmacist, the nurse, and the midwife. Because health centers or barangay the prescription of the doctor. Drag and drop. Provincial health and rural. No. Stop. Rural health units. Come on, reconnect. Live, please live. We are live, but then so anyway, if there is a lag on the live stream, answer primary health care. So provincial health office. City level. There's the mistake. Okay. So it's city health office, and then that's that barangay health stations. Let's get that out of the way. And municipal health office in the municipal level. Health centers in the city health office, and rural health units is the counterpart for provincial, and barangay health stations for the municipal level. So this is something I asked DOH why Olongapo City's name for health centers is rural health units. No idea. They only told me that it's what the city ordinance looked for, so it's wrong for Olongapo City to name RHUs and BHS. It's supposed to be, since it's an Olongapo City Health Office, it's supposed to be health centers. I think it's about the criteria of serving, so there's something wrong there. I need the attention of DOH to reclassify our health centers here in Olongapo City, because it's supposed to be health centers, not RHUs or BHS. Probably because I have no idea. So for some reason they changed it. We are a first class city, highly urbanized. So 20, pushing creation of municipal or city organs regarding implementation of AR policies is the of which of the PAS program. It's the local pharmacy and therapeutics committee. Let's go, finish attempt. We change the number 11. If I make a mistake in number 11, what bad will that do? I only need like 16 correct. So let's go. Let's check if I got all correct. Look at that. All of it is correct. That's the result of taking attention in everything. So in one whole sweep we were able to do the post test, and that is it. Next activity. Let me guess what is the next activity. It's a certificate. Agree. Objectives were met. Agree. Topics are relevant for my professional growth. Strongly agree. Yeah. Topics presented were relevant to the stated objectives. Yeah. They did not stray off. Siri did not stray off the part of the objectives. The topics were discussed clearly. Even visual materials are relevant and suitable to facilitate learning. Just, agree lang. Let's strongly agree. Are there any topics to the course that you want to be included in? Yes. What other topics do you want to include in the module? I would like to know why local public hospitals are in AMS monitoring, because it's really not included. I went through the pre-test, we went through all the stuff, and the local public hospitals not included in the AMS monitoring is not explained. What courses do you want to be uploaded in the platform in the future? I would like... what can I upload here? Yes. So I would like a smoking course. RA 9211. Smoking RA 9211 implementation course. I think that's what it is. Yeah. Let's find out what it is, man. Resource person evaluation is Siri, man. It's Siri. Why were there 2 live sessions? I do not know. I can finish this in 2 days, 1 day. Platform evaluation, easy to navigate. Disagree. I was not able to take the other modules because I did not know that there was a left and right button. The platform was easily accessible. Disagree. It always logged me out. Technical support promptly attended my concerns and queries. Strongly disagree. There is no technical support. Oh, yeah. Colleague friends, yeah. No. There is nothing learned. New learned in live session. Oh, I have to say it, man. Somebody has to say it. Submit the questionnaire. Let's answer it. And thank you for completing the questionnaire. Next activity, and here we go. The certificate of completion for the physician. View the certificate. Download the file. Yes, of course, download the file. Download in progress. Details, please. Let's see the download. Downloading. Okay, let's see the download, man. Here in Vegan, we just experienced a brownout and it's not downloading. Oh, there it is. For some reason, it's more than 1 megabyte. Oh, wow. Talagang may kulog at kidlat. Mukhang hindi kami makakapunta sa Kali Crisologo. Buti na lang nakapag picture na kami. If you want to see the pictures, nasa Facebook. Taran! Ang tagal! Wow, it's so long, you know, the downloading. Look at that. It's okay, man, because I'm trying to. Taran! See? Di man lang nilagay ang MD. Walang MD. You cannot cheat this one. You can, print this, put your name in there, but there is a. What's this in there? It's signed by somebody from DOH named Johanna Banzen. And it has a QR code. There. Whenever they check the QR code, they will see my name. My name and my name only. Thank you very much, ladies and gentlemen. That is the certificate of completion. Thank you, and thank you. I hope you guys enjoyed this series of lessons. Unfortunately, I was unable to place them in chronological order in the DOH podcast, and I hope you guys find it. So like and subscribe. We're going to learn more things in me. It's not meant for non-medical, but some of these things like the UHC is something that needs to be discussed, with the public, because the public usually has to be able to know the procedures and the standards of the health department, especially the local health department, why they are doing the things that they are doing, and why some of the public is left in the dark. So it's still a good thing to learn if you are not inclined. A more robust platform. Maybe we can try the WHO also, so that we can discuss it. Anything you want to ask me regarding this antimicrobial stewardship, you can put down on the comment section below. And also, if you like this video, give me a thumbs up sign. This is Zero Million MD, peace out, and I hope to see you soon in this series of podcast termed DOH Academy reaction videos. Thank you very much for watching. Mabuhay.